sorry, I keep bringing us back to things that were brought up forever ago, but when we were talking about trauma and the impacts of it and everything and recognizing it, one of the things that I have recently learned, relatively recently, like within the last year or so, is that there's actually a lot of different, I guess, diagnoses for trauma. Like, I think everybody's aware of PTSD. There's a lot of, focus on that or exposure to that. But I also learned recently of CPTSD or complex PTSD, and I heard a clinician joke that they call it childhood PTSD because it for a lot of people it stems from a childhood experience. And then Dr. Asher, you and I were talking not too long ago about ASD or acute stress disorder. What is the difference between all of those? What do they mean? Because I mean, they're acronyms. That's what I know.
They technically go back to the DSM-5 and DSM-TR, and a lot of times the diagnoses are based on time, as far as have they experienced within acute stress disorder. It could be the matter of hours or a few days.